Thank you for trying TechSmith's Camtasia Relay.
All right, we are going to go ahead and look at some of these different medications and see if we can remember the classification that they are in and the brand versus generic name. So here we go. Think about Singulair. Where does Singulair fit in with your classification system that you should have in front of you? Let's take a quick look online. If we look at Singulair, again, remember the generic name for that would be the monoleucast sodium. And this is the one, the reason this is one of the ones I'd like you to look at is, remember, this is not an inhaled medication. This is a pill form of medication that is one of the leukotriene receptor inhibitor medications. Where does Pulmicort fit in? What type of medication is Pulmicort? So the generic name for it is budesonide, and it's an inhaled corticosteroid. So it would fall under your anti-inflammatory inhaled corticosteroid medications. What about Flovent? So Flovent now is here. So we see it's a DPI, or when it's the discus, or it's the MDI form also. So it's fluticasone. Fluticasone, again, is another inhaled corticosteroid. So in that anti-inflammatory class of corticosteroids. Mucomyst. Mucomyst, then the class of medication of it is an anti-mucinetic. So the generic name then is acetylcysteine, and this is a nebulized medication. So Ventolin, we should all know this one because we've been giving it in the hospital a lot. Ventolin is the albuterol sulfate is the generic name. Here this is in a meter dose inhaler. And this would be our only, as Owen would say, our only SABA, our only short acting beta agonist. Foradil. What do we think about Foradil? Foradil is a long-acting beta agonist, so LABA. Formoterol is the generic name. It's another DPI, so more of a preventative medication. This picture is pretty blurry. This is our Combivent. So this was one of those combination bronchodilators used for patients with COPD with a combination of a short-acting and a long-acting beta agonist. Pulmazine. Pulmazine, you should think of this kid here having CF. So it's that, the generic name for that is the Dornase alpha. Pulmazine then is specific for patients with cystic fibrosis to go in and break up their mucus. So it's a cystic fibrosis agent that treats their mucus for their secretions. Ceravent. Ceravent is salmeterol. Salmeterol is also a long-acting beta-2 adrenergic agent, another LABA. Atrovent, probably been giving this in the hospital. Generic name, ipratropium bromide. So this would fall under the category of a parasympatholytic. So remember, this medication would go in and block the receptor site that causes bronchoconstriction. So it doesn't directly bronchodilate the airways, but it goes in kind of as the backdoor bronchodilator to go in and block the bronchoconstriction from occurring. Spiriva. Spiriva, we remember because we see their ads a lot on TV. It's tiotropium bromide. So tiotropium bromide should sound a little bit like ipratropium bromide. So this is going to fall into another parasympatholytic. And this is another one that will block bronchoconstriction from occurring. It's a DPI, and like their ad says, just 1 dose a day keeps the airways open. And they have their mascot is this elephant. Because breathing with COPD is no small thing. Okay, Xolair. Xolair has some warnings when we get it. So this is the one with the FDA approval that we want to get. Generic name for it is something I can't say very well. Omalizumab. However, that is, can't say that word very well, but it's a subcutaneous medication for patients with persistent allergic asthma. Again, it's going in to kind of block that histamine release. Xopenex. Xopenex is the brand name of the levobuterol. So this is that single isomer, quick-acting bronchodilator. Qvar. What's Qvar? Qvar is bunicillide. And so this one is the medication that we're going to use for another inhaled corticosteroid. Asmanex. Momentazone. This is a DPI form. Momentazone, again, is another corticosteroid. And there's the end of our show. I'll close that.
Thank you for trying TechSmith's Camtasia Relay.